everyone, welcome back to our Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss with important topic, that is anesthesia. Here, first we'll see the definition of anesthesia. Here, anesthesia is a medical practice that includes a reversible loss of sensation or consciousness in a patient, allowing surgical procedure or a medical interventions to be performed without causing pain or discomfort. Anesthesia is nothing but here it is one of the reversible loss of sensation or consciousness, we can say, that is to without interfering with the patient's, that is patient's discomfort. Next we'll see the types of anesthesia. Here we can see the three types of anesthesia. First one is general anesthesia. Here it is induces a state of unconscious and loss of sensation through the entire body. It is applicable to the entire body. And the second one is a regional anesthesia. Here it is going to block the sensation in a specific region of a body, such as epidural or spinal anesthesia. This one is the second type. And then we'll see the third type, that is the local anesthesia. Here, numbs a specific localized area often used for minor procedures. These are the types of anesthesia. Next, we'll see the methods of administration. First one is the inhalation. Here, inhalation anesthetics delivered through a mask or breathing tube. And then second one is the intravenous. Here, administered through a vein, inducing rapid onset of anesthesia. And then third one is a topical, that is applied directly to the skin or mucous membranes for local anesthesia, that is topical application. These are the methods of administration of anesthesia. Next we'll see the stages of general anesthesia. Here we can see the three stages. First one is the induction. Here the patient transitions from consciousness to unconsciousness. Induction is that is consciousness to unconsciousness. And the second one is maintenance, sustaining the desired level of anesthesia during the procedures. And then third one is emergence, that is the patient transition from again unconsciousness to the back to the consciousness. These are the stages of general anesthesia, we can say. Next one, we'll see equipments used in anesthesia. First one is the anesthesia machine that delivers a precise mixture of gases to the patient. And then second one is the ventilator, assists or controls the patient breathing during general anesthesia. And then monitoring devices. Here measures vital signs such as heart rate, blood pressure, and then oxygen levels. And then fourth one is the airway devices. Here ensure a clear airway during anesthesia administration. These are all the equipments used in anesthesia. Next we'll see the common anesthetic drugs. Here inhalation anesthetics, for example, includes sevoflurane and then desflurane, nitrous oxide and halothane. That comes under inhalation anesthetics. And next one we'll see intravenous anesthetics, that is propofol, etomidate and then barbiturates. These are the examples for anesthetics. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.